Hello, this is Taylor Payne and this is for the Cultural Competence and Healthcare Professions class. This is my Ethno Health Family interview. I have with me Trina Mason. She is a co-worker. She meets the criteria for this interview. Trina, will you introduce yourself with your age and full name?
My name is Trina Mason, and I am 48 years old.
Okay. Let's see. So the purpose of this interview is just to, we're looking at different generations and the difference between my generation and yours. So I just have some questions that I want to ask you, and do you give us permission for me to ask these questions and record and submit for this assignment?
Yes, I do.
Okay. First, I just want you to tell me a little bit about your ethnic background and your family growing up.
On my mother's side, we're Spanish, Native American, and Irish. And on my father's side, basically English, I guess, and also Native American. So pretty much just an American type lifestyle.
Do you know when your family first came to the U.S.?
I don't.
From
My
overseas?
great-grandfather was first generation from Ireland, but
Okay.
I don't know about the rest of my
Don't know
family.
about the game. Okay. As far as your family and yourself goes, what are some health maintenance practices that you yourself maintain? Ways that you keep yourself healthy, and practices that you have?
I always try to eat healthy, eat a balanced diet, try to eat lots of vegetables. The fresher, the better. Exercise on a regular basis, and just lifestyle choices. No smoking, drinking in moderation,
Definitely.
that sort of thing.
Definitely. What can you remember about your family, like, grandmother, grandparents, things that they would do, home remedies that they had that they would use to restore their health or maintain their health, when people were sick, or things that they did just to keep themselves healthy that you can remember growing up?
My mom used to have us take vitamins on a regular basis, but we also, like I said, try to eat a balanced diet, lots of fruits and vegetables to get our nutrients that way. If we were sick, she would give us various cocktails for, clearing congestion.
Like what?
Like whiskey and honey.
Yeah.
Also using like Vicks Vapor Rub with a warm towel across her chest or back when we slept.
Okay. As far as religious and spiritual beliefs, growing up, how did your spiritual beliefs and your family's spiritual beliefs growing up, how did these influence birth, death, and healing? What kind of rituals would your family do for, like, the child being born? Did they have certain rituals that they would do for that, or,
We believe in Jesus Christ and God. During my early years, I was raised Catholic. Now I'm just Christian. So we did baptism for children when they were born, or christening. Also, First Communion, going to church every Sunday. For as far as death, more along the lines of doing a wake, not so much a church service, more like a home gathering, celebration of life kind of thing. And we pretty much look at births and deaths as part of God's plan.
Okay. What about healing? Was there any rituals or things that your family would do to help if you had a family member that was sick or not in good health, any kind of rituals or practices they would do for family members or friends that were sick? Anything special you can remember?
Primarily trying to treat the whole person, but we pray together as a family and pray
Prayer
individually
groups.
with that person, and kind of spread the word and try to get people to help out, so that person who was sick didn't have to worry about, who was going to mow the yard or cook for their family or whatever.
Definitely. Is there any other anything that just stands out to you about your background growing up, or things about your family that just seems really extravagant or kind of out there for that you can remember? Anything special at your family or practice that just seems really unique to your background?
We moved a lot, so
you had a
pretty
lot of
much
different-
lived all over the United States. Moved every couple of years, kind of thing. So we pretty much, traveled as a unit. I guess you'd say we were very close as a family, and had to adapt to a lot of different areas where we moved. So our core strength was more in our just belief in being together and in God.
Okay. Well, thank you for the time, and this is all HIPAA protected questions. So that's what this permission slip's for. So thank you for your time, and thank you for listening to this assessment.
Thank you.